All right, now that we've read Chapter 41, Oxygenation, we're going to go back and do a review. So I'll ask questions and see how we know. Well, we know that if you use excessive alcohol use and other drugs that can impair tissue oxygenation, there are two ways that can do this. How can it do it? So first, if they chronically abuse alcohol, they probably have a poor nutritional intake. So this results a decrease in iron-rich foods, hemoglobin production declines, and then if they do this, they have like a depressed in the respiratory center, reducing the rate and depth of respiration and the amount of inhaled oxygenation. Just kind of like that. Talked about capnography a little bit. What do you think that is? It's entitled CO2 monitoring. It provides information about the patient's ventilation, how effectively CO2 is being eliminated by the pulmonary system, perfusion, how effectively CO2 is being transported through the vascular system, and how effectively CO2 is being produced by cellular metabolism. Capnography is measured near end of exhalation. So like as you're about to breathe inward, so that end part. These are a couple of nursing assessment questions. You can read these if you want, but they're basically straightforward. So we know with pain, it requires an immediate assessment because just because there's cardiac pain does not mean it occurs with respiratory variations. Chest pain in men is often on the left side of the chest and related to the left arm, and then chest pain in women is less definitive and is often sensation of breathlessness. So we know a cough is a sudden audible expulsion of air from the lungs. So the person breathes in, glottis is partially closed, accessory muscles of expiration contract to expel the air forcibly. Coughing is a protective reflex. The trachea, bronchi, lungs, irritants, and secretions. Patients with chronic cough tend to deny, underestimate, or minimize their coughing, often because they are so accustomed to it that they are unaware of its frequency. Patients with chronic sinusitis usually cough only in the morning or immediately after rising from sleep. This clears the airway, mucus resulting from sinus drainage. People with chronic bronchitis generally cough and produce sputum all day, although greater amounts are produced after rising through a semi-recumbent or flat position. Hemoptysis is bloody sputum, and then hematemesis is blood in the GI tract, stuff like that. And then wheezing is a high-pitched musical sound caused by high-velocity movement of air through a narrowed airway tract. It's associated with asthma, acute bronchitis, or pneumonia. So there are effects of aging on assessment findings in the cardiopulmonary system. So in the heart, the muscle contraction, what happens here? Thickening of the ventricle walls, you have increased collagen, decreased elastin in the heart muscle. This leads to decreased cardiac output and diminished cardiac reserve. What happens to blood flow as we age? Well, we know the valves become thicker and stiffer more often than the mitral and aortic valves, and that results in like a systolic murmur. What about in the conduction system? The SA node becomes fibrotic from calcification, and it decreases the number of pacemaker cells in the SA node. This leads to increased PR, QRS, and QT intervals, decreased amplitude of QRS complex, and irregular heart rhythms. What happens to arterial vessel compliance? Well, it leads to calcified vessels, loss of arterial distensibility, decreased elastin in vessel walls, and more tortuous vessels, which leads to hypertension with an increase in systolic blood pressure. What about the lungs? What happens to the breathing mechanics? We have decreased chest wall compliance, loss of elastic recoil, and decreased respiratory muscle mass and strength. That leads to prolonged exhalation phase and decreased vital capacity. What happens to oxygenation? We have an increase in a ventilation perfusion mismatch. It decreases the alveolar surface area and decreases carbon dioxide diffusion capacity, which these lead to decreased PaO2. So we know normal is 80 to 100, so it'll be decreased. Decreased cardiac output, heart rate, and stroke volume will be decreased. And slightly increased PaCO2, so normal is 35 to 45, so somewhere on the higher end. And what happens to the breathing control and breathing pattern? Well, it's a decreased responsiveness of central and peripheral chemoreceptors to hypoxemia and hypercapnia. This leads to increased respiratory rate and a decreased tidal volume. What happens to the lung defense mechanisms? Well, we have a decrease in the number of cilia, which has decreased IgA production and humoral and cellular immunity. This causes decreased airway clearance, diminished cough reflex, and increased risk for infection. And what happens to sleep and breathing? Decreased respiratory drive, decreased tone of upper airway muscles leads to increased risk of aspiration, respiratory infection, decreased PaO2, snoring, leads to obstructive sleep apnea. Then when we inspect the cardiopulmonary status, we know xanthelasma is caused by hyperlipidemia, corneal arcus is caused by hyperlipidemia as well. What causes pale conjunctiva in the eye? Anemia causes cyanotic conjunctiva in the eye. Hypoxemia causes petitchain conjunctiva in the eye. Fat embolus or bacterial endocarditis causes cyanotic mucous membranes. Decreased oxygenation or hypoxia will cause pursed lip breathing associated with chronic lung disease, will cause distended neck veins. Usually right-sided heart failure causes flaring nares of the nose. Air hunger and dyspnea will cause chest retractions. Increased work or breathing or dyspnea will cause chest asymmetry. Chest wall injury causes peripheral cyanosis of the skin. Vasoconstriction and diminished blood flow will cause central cyanosis of the skin. Hypoxemia will cause decreased skin turgor. Dehydration causes dependent edema of the skin. Right and left-sided heart failure will cause paraorbital edema. Usually kidney disease will cause cyanosis of the fingers. Decreased cardiac output or hypoxia will cause splinteral hemorrhages of the fingers. Bacterial endocarditis will cause clubbing. Chronic hypoxemia. I got this in here. I'm not sure if this is really important, so you can read over that if you want to. And then this too, and these two as well. I'll scroll down, I'll let you read them if you want to. I'm not really sure how important they are as of right now. Now we get to our interventions, so like what we're going to do to help with oxygenation and stuff like that. So we know that dyspnea is hard to treat. We can use things such as like bronchodilators, steroids, and different medications, stuff like that. Not too bad. We know we need to keep airway open, keep it clean and stuff, so we do this by coughing techniques. We can also do like suction, chest physiotherapy, and nebulizer therapy, stuff like that. We have to mobilize pulmonary secretions. We know that. Hydration, make sure they're getting enough water, stuff like that. What's humidification? Process of adding water to gas. And the most important factor affecting the amount of water vapor a gas can hold is temperature. So let's say a patient's on oxygen therapy. When do we put patients on humidification? When they're greater than 4 liters. Now, what is nebulization? It's like adding moisture or medications to inspired air by mixing particles of varying sizes with the air. Now, what are the 3 chest physiotherapies? Got like postural drainage, chest percussion, and vibration. Type of patients will get chest physiotherapy. Patients who produce greater than 30 milliliters of sputum per day or have evidence of atelectasis on chest x-ray. And then what's postural drainage? It's basically like pulmonary hygiene, such as like draining, positioning, and turning, and sometimes it's accompanied by percussion and vibration. So this basically helps with secretion clearance and oxygenation. So there are positions for postural drainage. So if you put them in high Fowlers, that'll get the bilateral lung segment. If you put them in a right side lying Trendelenburg, that'll get the lower lobe lateral segment. If you have them sitting on the side of the bed, that'll get the apical segments. If you have them in the left side lying in Trendelenburg position, what segment will that get? Right lower lobe lateral segment. What if you have them supine with head elevated? What will that target? Right upper lobe anterior segment. What if you have them prone with right side of chest elevated in Trendelenburg? It's right lower lobe posterior segment. What if you have them in supine with head elevated? Left upper lobe anterior segment. What if you have them in prone with thorax and abdomen elevated? Right middle lobe posterior segment. What if you have them side lying with right side of chest elevated on pillows? Right upper lobe posterior segment. What if you have them supine in Trendelenburg? Both lower lobe anterior segments. What if you have them side lying with left side of chest elevated on pillows? Left upper lobe posterior segment. What if you have them prone in Trendelenburg position? Both lower lobes posterior segment would have 3/4 supine position with dependent lung and Trendelenburg position. Right middle lobe anterior segment. So with suctioning, we're going to have it sterile because the oropharynx and trachea are considered sterile and the mouth is considered clean. Therefore, you suction oral secretions after suction oropharynx and trachea. 100 to 150 milliliter mercury per adult. You can read this if you want to. So oral airways, the simplest type of artificial airway, prevent obstruction of the trachea by aspiration of the tongue and oral pharynx. We know that. We know we also have ET tubes, stuff like that. Hang on, see if I missed anything. Come back to that in a second. And we have ET tube, short-term artificial airway to administer invasive mechanical ventilation, relieve upper airway obstruction, protecting aspiration to clear secretions. Most common complication of tracheostomy tube is partial or total airway obstruction caused by buildup of respiratory secretions. Why would we use oropharyngeal or naropharyngeal suctioning? Use it when a patient is able to cough effectively but can't clear secretions by expectorating. So apply suction after patient has coughed. Once the pulmonary secretions decrease and the patient is less fatigued, he or she is able to expectorate or swallow the mucus, and suction is no longer necessary. What do we know about oropharyngeal or nasotracheal suctioning? It's when patient with pulmonary secretions unable to manage secretions by coughing and does not have an artificial airway present. So put a sterile catheter through the mouth or nose and the trachea. Nose preferred route because less gag reflex. Kind of advance it slowly. Oxygen if they need it, stuff like that. We want to get them as mobilized as possible because we can get problems with mobility issues, stuff like that. If they're immobile, muscle strength declines as much as 20% after like a week. Gotta get them moving, stuff like that. Positioning. Getting positioning helps, but it doesn't do everything. However, what's the most effective position to promote lung expansion and reduce pressure from the abdomen and diaphragm? 45-degree semi-Fowlers. What can you tell me about incentive spirometry? So it encourages voluntary deep breathing by providing visual feedback to patients about inspiratory volume. What do you know about invasive mechanical ventilation? It's kind of like a positive pressure ventilation. So like you use it for reversing hypoxia and acute respiratory acidosis, things like that. You can get ventilator-associated pneumonia. Then you have non-invasive positive pressure ventilation used to prevent invasive artificial airways in patients with acute respiratory failure, cardiogenic pulmonary edema, or exacerbation of COPD, stuff like that. Like with NPPV, you're gonna have like CPAP, continuous positive pressure airway, continuous positive airway pressure, and then beat BiPAP, stuff like that. So we know a pneumothorax is a collection of air in the space. Hemothorax is blood in the lungs, basically too, stuff like that. Don't clamp a chest tube when ambulating or transporting a patient. You can get tension pneumothorax. Don't want that. Oxygen therapy. What do you know about oxygen therapy? Stuff like that. Get to that down here, hopefully. Safety precautions. Oxygen is a therapeutic gas and must be prescribed and adjusted only with the healthcare provider's order. Distribution must be in accordance with federal, state, and local regulations. Place an oxygen use sign on the patient's door and in the patient's room. Using oxygen at home, place the sign on the door of the house. No smoking should be allowed on the premises. Keep oxygen delivery systems 10 feet away from any open flames. Determine that all electrical equipment in the room is functioning properly and correctly and properly grounded. When using oxygen cylinders, secure them so they don't fall over. Store them upright and either chained or secured in appropriate holders. Check oxygen level of portable tanks before transporting to ensure patient that there is enough oxygen in the tank. Looking at delivery systems, how many liters does a nasal cannula deliver a minute? 1 to 6. At what percentage? 24 to 44. What are the advantages of the nasal cannula? Kind of like safe and simple. It's easily tolerated, effective for low concentration, does not impede eating or talking. It's inexpensive and disposable. What are the disadvantages? Unable to use with nasal obstruction, drying to mucous membranes, can dislodge easily, may cause scarring, irritation, or breakdown around ears or nose. Patient's breathing pattern affects FiO2. What is the liters per minute of a simple face mask? 6 to 12, and what percentage? 35 to 50. What are the advantages of the simple face mask? Useful for short periods such as patient transportation. What are the disadvantages of the simple face mask? Contraindicated for patients who retain CO2. It may induce feelings of claustrophobia. Therapy interrupts it with eating and drinking and increases risk for aspiration. What is the liter per minute of partial or non-rebreather mask? 10 to 15 liters. At what percentage? 60 to 90. What are the advantages? Good for short periods. Delivers increased FiO2. Easily humidifies oxygen. Does not dry mucous membranes. What are the disadvantages? Hot and confining, may irritate skin. Tight seal necessary. Interferes with eating and talking. Bag may twist or kink. Should not totally deflate. What's the FiO2 of the oxidizer? 8 liters a minute. At what percent? 30 to 50. What are the advantages of the oxidizer? Indicated for long-term oxygen use in the home, and it allows increased oxygen concentration and lower flow. What are the disadvantages of the oxidizer? Cannula cannot be clean and is more expensive than standard cannula. What is the FiO2 percentage of the Venturi mask? 24 to 50%, and if I'm correct, I think it says 4 to 12 liters. Advantages of the Venturi mask. Provides specific amount of oxygen with humidity added. Administers low constant oxygen. What are the disadvantages of the Venturi mask? Mask and added humidity may irritate skin. Therapy interrupted with eating and drinking. Specific flow rate must be followed. I'm not sure how important these are. I would read this over every time we go over it, but I would take some time to read this. So what do you know about pursed lip breathing? So it's a deep inspiration, prolonged expiration through pursed lips to prevent alveolar collapse. While sitting up, instruct the patient to take a deep breath and exhale slowly through pursed lips as if blowing through a straw. Film her blow through a straw into a glass of water to learn a technique. Patients need to gain control of exhalation phase so it's longer than inhalation. Patient is usually able to affect this technique by counting the inhalation time and gradually increasing the count during exhalation. It's a very good technique. What do we know about diaphragmatic breathing? Good for patients with pulmonary disease, post-op patients, and women in labor to promote relaxation and provide pain control. But this is kind of difficult. Like, you gotta master your hand movement stuff with it like that. That's everything.